Hello, everyone there. I think we've got lots of participants, 23 people now. I'd just like to introduce myself. My name's Adrian Richards, and this is Fiona Durban. And on the lower screen, we've got Dr. Olya. So a bit of background about us. I'm a plastic surgeon and founder of Cosmetic Courses. Fiona, do you want to introduce yourself?
My background is as a GP, so I was a partner for 7 years, but I've been doing aesthetics full time now for over 9 years, and I'm clinical lead at our Bucks location.
Brilliant. And Olya, do you want to introduce yourself a little bit there?
Yes, with pleasure. Thank you, Adrian. I'm a dental surgeon by background and has been practicing in facial aesthetic for nearly 10 years and work with Cosmetic Courses since 2015. And I'm a clinical lead across Midlands location. Nice to meet you guys.
Yeah. So guys, lovely to meet you. Thank you very much for joining us for this webinar. What we're going to be doing first is a little video talking about what you can expect from potentially a new career. Then we're going to do a little presentation, tell you a little bit more about Botox, botulinum toxin, the courses, the options available to you. And then we're going to have a question and answer session at the end. So if you would like to have any questions, please put them in the Q&A box and we'll answer them between us. And now we're going to start the short video. Yes, so the video will be starting any second now. Few technical issues. Here we go. So Cosmetic Courses is the longest established training course in Botox and dermal fillers. A picture of me walking into our Princess Risborough Centre. This is our Princess Risborough Centre. This is our main centre in Princess Risborough.
My name's Adrian Richards. I'm a plastic surgeon and I'm also the clinical director of Cosmetic Courses. Cosmetic Courses is the UK's longest established Botox training provider. We provide a wide range of training courses for medical professionals looking to start or build their career in aesthetics. Cosmetic Courses is quite unique amongst training providers in that we focus really on you, and one we pride ourselves on is that we use live patients to train you. We feel it's really important that you gain experience in treating real people, real patients, rather than learning the treatments on inanimate models. All of our training at Cosmetic Courses is fully accredited. You'll receive CPD points for your training day, and we also have a level 7 course which is fully accredited with IQ. All of our training at Cosmetic Courses is regulated by the highest standards within the United Kingdom. At Cosmetic Courses, we offer 24/7 support for you both clinically and in your business development. So what's really important is when you come on our foundation course, we are there for you afterwards to help you on your aesthetic journey. Why not contact our expert team today to see how we can help you start and develop your career in the aesthetics industry.
So that's just a quick overview of Cosmetic Courses, and now we're going to be running into a little bit of a presentation to talk you through things. Fiona, do you want to add anything about career in?
Yeah, only that obviously to those watching for the rest of this week, we have got a discount code you can see, which offers you 20% off our foundation course or other courses. If it's level 7 you're interested in, Beth, our coordinator, would be ready to take your course tomorrow. So if we have a look at the information first.
Brilliant. So the question is, are you ready for a change? Most people who come into Cosmetic Courses, only doctors, nurses, only medical professionals are trained here at Cosmetic Courses. Very controversial who can perform these treatments in the UK, and there's regulation coming, and we're involved with the regulation. So we train medical professionals, and the majority of people who are looking for a change in their career. So Fiona, you were one of these people, weren't you?
Yeah, so I sat at Cosmetic Courses in 2012, having been a partner in general practice, wanting to do something different that was more flexible, that suited me and my family. And I've made it into something I enjoy because I train, I run a clinic here at Bucks. So a mixture of different things with a mixture of different procedures. So,
and what was the pro for you moving from GPing to non-surgical? What made you, what are the good points?
The good points are the time you can spend with your patients, not feeling as rushed, not having just 10 minutes per patient, having to log on and do blood results at 11 o'clock at night, working the days I wanted to work, confining my work to the working day, not feeling, I mean, I think like lots of people at the moment, burnt out, doing the best you can within the NHS, but also having flexibility to choose what direction my career went into. I liked teaching, so I liked going into the teaching aspect. Having the flexibility and the time to see patients properly, I think, were the main things.
Yeah. And Olya, I know you've developed a clinic and quite a big setup. What was the main thing that the main reason for you moving from dentistry more to the aesthetics area?
Well, first of all, I would say it's to do something that you really passion and enjoy. And when I came on the foundation course again with Cosmetic Courses in 2013, I thought that I will enjoy aesthetic industry, and in fact I was very right, but it was just these first steps, booking the course and trying to find if that is right for you. It was a definitely right step for me, and from there I realized it's give you much better relation with your patient. I would say for me a big stepping stone was that most patients who walk into our dental practice, they have fear, they really don't want to be there, and sometimes it can make your job not as enjoyable. In fact, dentists consider one of the most stressful professions. When in aesthetic practice, people definitely want to be there. They come because of choice. There is no need to come for those treatment. And that is this strong bond and relation and loyalty that you build with your patient. And on the other hand, it's also careers that can give you amazing opportunities. You can grow, develop yourself, your clinic. You can when you build your clinic, you can make a passive income for yourself. So I'm going to talk about all these opportunities in my slides later, because I went through all these stages myself, and I think it will be very nice to share with you this experience today so that you can make the right choices for yourself too.
Brilliant. Well, thanks, Olya. So what we're going to be doing is running through a little sort of slideshow to talk you through what's available. So that's me on the left, Fiona in the middle, and Olya on the screen. So what are the benefits of a career in aesthetics? These are mainly them. Feel free to join in.
So I think these are, Olya was this.
Yeah. Do you want to run through these, Olya?
Yes, absolutely. So I think medical, like transition into medical aesthetic, when you already have your medical degree, can be, for some practitioner, you can choose. It could be as slow as you wish, or it could be at full pace on. And it gives you an incredible opportunities of choice and to be in control of what you want to do with your life, with your work-life balance, with your career, and with your income as well. So in medical aesthetic, you can choose a road of be a self-employed practitioner, which I would say that is a road for most practitioners who start their journey in aesthetic. That is where you can work with a chain of clinics, independent clinic. Some practitioners choose to work in multiple clinics, and you can also work as a self-employed practitioner for yourself. I think dentists probably will understand this very easy, because most dentists who work in general practice self-employed. If you're a GP practitioner or a nurse, and if you haven't been familiar with the self-employed way of working, that is something that we will be able to give you some guidance and answers at Cosmetic Courses. It's just a different way of setting your accounts with HMRC and submitting tax return annually, where you're not a salaried practitioner. What became also quite popular nowadays is building your personal brands, and many practitioners do this alongside with the clinic, because first, you want to showcase your work. You might want to put your name out there and want to be recognized for a specific treatment that you are good at. So facial aesthetic gives you this great opportunity to showcase your work, build your personal brand. And some practitioners do this not necessarily on their actual works. They do it based on patient education, educating their patient on the skincare, what is available out there, and becoming quite successful this way. You can choose to be employed practitioner with the clinic as well, but I would say it's not as popular practice as self-employed, because in this case you're more attached with one clinic. When you're self-employed, you have a little bit more choice and freedom of your working hours, about which clinic you want to work at. So, and also you have opportunity to build your own clinic. Building your own business probably is a hard task itself, but many practitioners have it as a goal, aim, and eventually achieve it. So in medical aesthetics, all the time new treatments coming up, but despite that, injectable treatments such as Botox and dermal fillers are strongly hold a quite high percentage of the revenues that come into your clinic. And let's be honest, guys, I don't think there is anything has been invented that could beat Botox treatment so far. Everyone knows about it, it works, it's lasts, it's relatively safe treatment to perform, and patients love it. So you can't, however, rely just on one single treatment in your clinic. It's nice to offer patient a whole package and a journey. And therefore, you can build aesthetic clinic on relatively low investment, where your investment comes from your knowledge training, and you don't need to commit to buying huge machinery, equipment, and things like that. And basically, those main treatments are allocated on this slide, that is injectable Botox, fillers, skincare sales, and skin rejuvenation. And if we have a look at the numbers of patients that you need to build successful clinic, you don't need a high numbers of patients, because all those patients are coming back to you regular. And that is the beauty of that commitment to a journey. I will relate to the dental point of view. To the dentist, people come to us to have their checkup regularly, but they don't need regularly to have crowns and fillings and implants. That is a work that lasts them 5 years plus, in some cases 10 years, and implants could be a lifetime. Yet patients reluctant to spend on those treatments, and they much more prefer invest in their look and their face. And I can tell it based on my personal experience. And you can see on this slide that only on 50, having 50 patient, regular 50 patient on your books, you can have a very good revenue for your clinic. I would say, again, comparing to the dental practice, it will be unsustainable to run it on 50 patients on your books. Now, how success happens and why we see so many practitioners in aesthetic who become so successful and grow their clinic and become international practitioners and have clinic in multiple locations. but important things to realize that behind each overnight success is the years of hard work and experience. So, however, everything is possible. And when I started my journey with cosmetic courses, it was a journey that started with patient number one and rented room in one of the beauty salons. Today, I have two clinics with the physical present location on the high street, which is independently earned. We earn a freehold of the building. We work in partnership with the cosmetic courses, and it's all possible to achieve with the right plan, right steps. But one thing that I think you always need to do is to make this first step, because without trying, you would never know where life can bring you and what opportunity you might have. A big advantage of medical aesthetic, in my opinion, I can't think about any other business that you can start with investment of less than £10,000. And it is actually true without any exaggeration, because you need to invest in your training first and foremost, and that is the area where you can't compromise, especially in today's environment where aesthetics becomes hugely popular, very competitive, but in a very positive way. Don't be afraid to step in something unknown if you're new to aesthetic, because patients, more and more patients want this treatment, and you will find in your circles of friends, your circles of families, that so many people are interested in those treatments. So training is very important, and that is your main investment. And after that, you can start as little as you wish, from renting a room, working at another clinic and gaining experience. And then later down the line, you might want to take a step and set up your own clinic. I completely understand that stepping into something unknown could be a little bit risky, but without taking some risks in our life, we would never get anywhere. So how you can build your own clinic? Is it easy? Is it hard? I will share with you based on my own experience. And also, I think it is a safe and predictable way without taking minimal risk. First of all, see if you're good at it. For that, you just need to start your journey with the training. After this, you might want to treat people that you know, or if you feel comfortable and have a good feedback from your training provider, you might want to treat a wider group of people. Find a space like renting a room in a clinic or salon. Start as a single practitioner. That is a big advantage as well. You might be a receptionist, a practitioner, manager, all in one, as a one person, until you will find that, yes, I have a need, I have more inquiries through the patient, I need help within my team. That is when you start to looking for outsourcing the work and try to concentrate on what you're good and spend your time wisely. However, you always need to be involved in all aspects of your work. You need to know how the marketing works, how you want your reception to run. That is why it's useful to know these aspects of your work in the clinic. You might be wondering how you will get your patients, where your patients will be coming from. Marketing is a very powerful source, but despite all the boom in social media, in the Instagram, TikTok, Facebook, still majority of your patients won't want to come to you by personal recommendation. And that is actually probably the best patient you can get, because that is patient who are thorough, who considerative, and who want a reassurance that this practitioner is good, safe, and my friend have had a very good result and experience there. However, don't neglect aspect of social media, because that is where people want to see and find information about you. They expect you to be out there these days. planning is very important and planning is a huge part of any successful process. So plan from the beginning, what would you like from your new venture? Do you want it to be your extra hobbies? It gives you some income, or do you want to build it into successful business with potential exit strategy, retirement plans, and have a better work-life balance for yourself and your family. At Cosmetic Courses, we help you at all aspects of your journey. And I believe the next slide will be down to Fiona when she will be talking with you about other opportunities and careers and steps and some obstacles that you will find on your during your journey with aesthetics.
Brilliant. So thank you very much, Olya. That's absolutely brilliant, covering, you know, the benefits to you, how to set up business. Olya's been phenomenally successful in the last few years of building up a great practice with real.
Thank you.
And also Olya's very well known on the speaking circuit, talks internationally. So she's, you know, really become one of the sort of superstars of aesthetics.
Thank you, Adrian.
Yeah. Now we're on to another superstar of aesthetics. Who is Fiona, and Fiona's going to be talking us through more of the clinical aspects of building practice and training.
So really what you want to decide is what the personal benefits to you of doing aesthetics are. And the number one has to be what you want to get out of your work-life balance, what's important to you. And I talked about flexibility. Do you want it to run alongside your NHS career? Because that can work very well. Or do you want it to be your main career? Do you want to employ other people? How much time do you want to spend? But there are other benefits, and we're not going to say it can be lucrative. So you can make a lot of money in aesthetics with your own clinics, building your own business. You can make a comfortable income, not working as hard as you might have to do within the NHS. Time management, you know, flexibility of your time, spending as much time as you want with your patients is key. Not being told you've got to see 30 patients in 2 hours, I think is really important for lots of us, and developing your career in the way you want to develop it. You know, I've become a trainer and I lead a clinic, but you might want to work within the pharmaceutical industry, you might want to work with different clinics. So it's down to choice and flexibility, which I think is really important. So if we go on to the next slide. Pitfalls. Now we've got a picture of this lovely lady here, but I clearly often get pictures from our delegates saying, what can I do for this lady? And they're 80 years old, never had anything done. And you have to recognise that not everyone is appropriate to be treated aesthetically. And that is something you've got to learn. You know, when are they too late? When should you refer them for surgery?
When's too much as well, Fiona?
When is too much? So when to say no. So having realistic expectations of what your treatments can do is an important part of the training. And also a realistic expectation about training. You cannot just come on one course and expect to never go on training again and be really good at this job. It is like any medical specialty. You have to have continual training and development in areas that interest you, in new techniques to get bigger and better. And that doesn't have to be all at once, but it can be a journey. Also expectations about your business development. I mean, Olya did not become successful with her clinics and training overnight. It takes time to develop a business, to develop a clientele, to start making the money you want to make. So you do have to have, I think, realistic expectations. And consultation skills. I think the biggest thing you have to learn, and what most NHS clinicians are good at, is speaking to our patients. And listening to patients. What do they want? What do you think you can deliver for them? Coming up with a plan. And I think based solely on consultation skills, you will develop patients that come to you several times a year and are loyal. I've got patients I've seen for 9 years. They only have to tell one other person to double the number of patients you see. So that, you know, there are some common pitfalls that we see commonly and can guide you on and how to avoid them, I think.
You have all got good clinical skills because you're a clinical basis. So talking to the patients, looking after the patients is what you're good at and what most of us like doing. And the difference is that most of our patients, obviously in aesthetics, they're unwell. So it's a very sort of positive environment. And also you have much more time to look after your patients, and you've got continuity so that you are responsible for the long term. So there's not a lot of chopping and changing.
No.
So great. What sort of skills would you say you need to be successful?
The biggest is communication
Communication.
skills. Practical skills,
Yeah.
because at the end of the day you're going to be injecting, so you've got to be quite dexterous, you've got to have an aesthetic eye.
Yeah.
So I'd say being a bit artistic, seeing what's needed. Management, so time management, perhaps managing other people. So business and medical skills combined, but that's what becomes then quite interesting.
And one of the great things is you are your own boss, if you see what I mean. So there's no one really telling you what to do. So you are responsible for the quality of your treatments, and you know that is a great way to be.
Yeah. So this slide is just showing you what the sort of aesthetic courses and journey can look like. Obviously, you have to start at the beginning, and that's with the foundation course, but there are lots of other options. A lot of people will then go on to more advanced courses, one-to-one training. We can do surgical, non-surgical facelifts, thread lifts, but you might be more interested in rejuvenating treatments, peels, microneedling. So you can craft together out of your interest what you want to train in, but also there is room for progression. And we see lots of delegates year on year who just want to refresh on things. And I think one of our strengths is being able to offer courses that are more bespoke, that's one-to-one or in small groups, where you might phone us and say, actually, I just need more practice doing some lip treatments with cannula or some temple treatments, and we will put a specific course together for you.
So Fiona, can you tell us a little bit? So someone coming new into the industry.
Yeah, which I think we've got coming up here. So
Lovely.
So first steps, foundation course, which is a day where you learn the basics of Botox and filler. A lot of people will buy our introduction to aesthetics package, where they also get an intermediate training day, a chance to review what you learn on the foundation day, but you also get a half day one-to-one training day or an introduction to lip training day. You get a starter kit, you get some product to take away with you. You immediately get clinical support where you can contact us via email or phone anytime, share pictures of the patients you've treated. So a lot of people will go that route. Some people would like to start with our level 7, which is a qualification that's of master's level, will take a year. So you're attached to us over a period of time and do a mixture of online learning as well as practical days, and that will be formally examined. So some people will choose to do that route, which is not mandatory, but is seen within the industry as something to aspire to at the moment. So they would be your first steps, but would all start with the core training of our foundation day.
Yeah, and probably the thing to do, guys, because everyone is so different, is contact us. So if you are thinking of a career in aesthetics, phone us up, contact us, and one of our experts will be able to chat to you about the best way forward for you.
And then everyone also talks about, well, how do I start? How do I find that job? And we are associated with a recruitment company called Clinic People, who can help place you in a post within a clinic if that is what you want. So we have a number of clinic groups who will contact Clinic People, especially at the moment, looking for practitioners, and they can help find you that job. Often they do require some experience, and we can guide you through how you might get that. So it's fair to say a lot of people do some on their own, friends, family, start to rent a room, but we have got that support with Clinic People there as well.
So, you know, when you start, I mean, a lot of people have hybrid careers, but most people don't give up their main career initially. But working with a clinic has advantages in you get volume. So you have patients, you get to build up your clinical skills, and you can also have a hybrid career with your own patients.
And this is just showing you the other support that you can expect from us. We do recommend you use, for instance, an iPad-based note system. So one of which we're associated with is free for your first 100 patients. We're always there for clinical advice. So I have delegates who email us who haven't seen us for a few years. We'd never ignore you. So we answer those questions or by phone if it's something more urgent. We do have an online academy. So lots of people will do some of the courses for theory online and come and do shorter practical courses if that's what suits you. Lots of free online resources. We're associated with an insurance company as well, so we can give you advice regarding where to get your insurance, as well as the recruitment company that we talked about. So all these things just make that transition, I think, into aesthetics a bit easier, because at the end of the day, it can be a bit lonely. You go from an NHS environment where you're used to being in a team to suddenly doing something on your own, and this makes you feel a little bit less on your own, I think.
We're your team, really. Okay, so for any of you out there, we had a question recently from a past delegate, and the first person who answers this on the Q&A wins a prize. So a patient rang up, so a delegate rang up, she'd trained a month ago, she'd been doing very well on Botox and fillers. She had a patient she was doing botulinum toxin treatment on. The needle accidentally separated from the syringe, and the botulinum toxin went in the patient's eye. She rang up, she washed the eye out, she was very worried about it. She rang up. What was our answer? What did we advise her to do? So first answer on the Q&A wins a prize. And we are watching, aren't we, Fiona? Yeah. So should you worry if you put botulinum toxin inadvertently in the eye? 10.
So what we also wanted to say is we are introducing a new mentoring program. So this is going to be for only a few delegates, because we simply can't take a large volume of delegates for obvious reasons. So this is designed to really lead you predominantly through your first year in aesthetics. So you would be given a named trainer that you, after foundation, would have a one-to-one day with clinically, so training for a day, and at the end of the year, a half-day training session. You'll get the opportunity to have 3 meetings throughout the year with them, either in person or online. You would also be invited to come for an observation day of observing different treatments that trainer's performing, and throughout that year, any questions and answers, mentoring that you need will be specific to that trainer, with the idea at the end of that year to help to find a job with clinic people if that's what you want. So if you are interested in the mentoring, again, you can call us. We have got people on the phones till 8:30 tonight or tomorrow, or give us an email. The phone number's 01844 390 110. So if you do want to call, but the mentoring is a new package that we've just felt fits for some people wanting a bit more hand holding and support, but it will only be for limited numbers of delegates, because we don't want to.
And with the potential employment opportunities
at the end.
Brilliant. Good stuff. So we just wanted to show you a little bit of the good and the bad. So Fiona, do you want to talk a little bit through this?
So I think the best compliment is someone saying to you, I wouldn't recognise any of your patients on the street. So we like natural results that don't look done, that keep people guessing, not the overinflated cheeks, the lips that could stick on a window, and the face that doesn't move. Some people provide that or want that, but I don't think that's what we would like to see, and most of our patients don't want that either. This apparently is a good example of what we're aspiring to.
So this is, so she looks good, doesn't she?
Yeah, she does.
You know, natural, not unnatural, but she has had treatments. What treatments would you think she has? Let's go for Ola. What would you say, Ola?
Well, thank you for getting me involved, Adrian. I felt a little bit left out. You have a nice company of Fiona.
No.
So I would say most likely she used regular anti-wrinkle injection because her brow line, position of the upper eyelid is very good through their age. Possibly augmentation around the cheek area, which is probably one of the most rewarding anti-aging treatment, and maybe a very nice works around the jawline. Most definitely a regular good skincare routine and skin treatments. And
you've not had teeth whitened.
Well, you see, Fiona, my attention was completely off the teeth on the face, but yes, more probably she have had her teeth whitening as well, which if you're a cosmetic dentist, facial aesthetic and cosmetic dentistry going hands in hands together. So if we have any dentist watching our webinar today, it's very interesting fact. I have many aesthetic patients in my clinic who ask me about cosmetic dental work. So if you are considering orthofacial aesthetic, you might increase your private dental work at the same time, because it's the right demographic and group of patients who are interested in aesthetic of their face as well as aesthetic of their teeth.
Yeah.
So what do you think, Fiona? Did she have anything else? Have I missed anything?
No, I agree. I think without doubt, upper face Botox or toxin. I think mid-face filler, possibly jawline, although she could have some lower face toxin for that. And
yes,
without a doubt. So rejuvenating treatments of some description, and definitely the teeth.
Yes. So that is Cindy Crawford. And there's how many years between two photos?
I think there's 30 years.
30 years.
Photos.
Yeah. So this is what we're aiming for. Again, as Fiona says, and Ola says, a very natural result. What we're aiming to do is slow the aging process and make people look as good and fresh as they can, rather than making them look old. Now, Fiona, do you want to talk me through this one?
So, I mean, I think this is just, and what was her name? Friends lady. It's not Jenna. Yeah, Monica.
Monica.
She just went through a stage of looking obviously overdone, and here, to me, the sort of cheeks are overinflated, almost start making the eyes looking a little bit sunk in. She just looks a bit too severe, not quite as soft as she should look. The lips have been augmented, but not really with much shape. So there's just something that she's got what we call the bunny lines at the side of the nose. So she's had Botox, but it just looks too harsh.
Yes.
So to us, this is not a great example. I think Renee's as well went the same way for a period of time. So it's just having that mindset that we are also the gatekeepers to these treatments for our patients, and our patients don't always know what's best for them. So I think it's really important that we guide them as to when they should stop or what they should do.
That's a good point. So I just want to talk you through some of our success stories. So this is Martin Kinsella. Now he trained with Cosmetic courses and has gone on a meteoric career, really. He's featured in, he's a bit of a celebrity now.
Cheshire Housewives.
Housewives of Cheshire, I think. And he's in, his wedding was in Hello magazine. So he's now a sort of celebrity esthetician. He trained through Cosmetic courses and, started, from the foundation and then built all the way up, and is very successful and is, key opinion leader. So he's one of our success stories. Another one, Jake Sloan. He was a doctor who trained cosmetic courses and then moved to Australia, and he's become very well known as key opinion leader in Australia. So we've got lots and lots of success stories, and what we absolutely love is when we go to the conferences for our previous delegates to come and say their stories. Yeah.
So again, there is this web code which, once you put a course in your basket online, you can put this code in for 20% off. This doesn't include the new mentoring, so if you are interested in that, you're probably best to phone or give us a ring tomorrow, and then we were going to look at some questions and see who might have answered your Botox questions.
I see we've got lots of questions here. So let's just run through some of the questions, Fiona, and perhaps you could well, the first one is, what is covered on the foundation training day? Ola, do you want to take that one?
So foundation training day is, I think, very informative day, and delegates definitely come out of this day with a lot of enthusiasm, a lot of information, and I think we give them the right direction, what they need to do next. So foundation day is, you have a lecture where trainer goes with you not just about administration of Botox and fillers, but also gives you some information about how to apply those skills that you gain on the day into practice. So they give you idea how you order your products, what you need to set up your clinic, You also have some information about what option you have to practice, which we briefly went today through during the webinar. And also that is a morning, and in the afternoon you have a practical session. What I would like to highlight, that at Cosmetic Courses we hear a lot of positive comments from delegates that our groups is very slow. Oh, sorry, very small, not slow, very small numbers. We keep the ratio of delegate to trainer between 3 to 4 people, so that everyone could get right attention and you have a hands-on practice. Each person treats 1 full case of upper face Botox, and you perform a full treatment of dermal fillers. Full treatment, it means you treat a full cheek or nasolabial fold, maybe perioral lines. So it gives you enough to get confidence and understanding either that is a right pathway for you or not. And after that, most definitely delegates who have a serious intention to practice, they will book further training, either level 7 or further courses, which will be intermediate course, introduction to lip, and one-to-one session, which will give you enough knowledge and confidence then to go and practice on the patient.
Brilliant, thanks Ola. There's a couple of questions here. So Ozzy Khan says, excellent talk, can we please have access to the video of this webinar? Yes, they're nodding there, yes you can. Ozzy will send you a link. Okay, Lorna Evans, do you train delegates how to correct errors, i.e. dissolve fillers? Fiona.
Yeah, so part of any of our courses, and even from the foundation, we talk about managing complications. And in our foundation booklet, we give you access to a protocol which you then talk through use of hyalase, which is what we use to dissolve fillers. Equally, we always, this part of our questions online is if you've got photographs of patients that you're worried about with a complication such as an infection or simple like a spot brow, we can talk to you or email you and help run you through managing that complication. So yes, it's part of the course, as well as part of our ongoing support will be management of complications or side effects.
Okay, and we've got another question here, which Ola, could you do this one? So guys, keep your questions coming in the Q&A box here. We're going to be here till 8, so keep all your questions going. It's lovely to see your questions. Question here, Ola, do you have to be a prescriber to be a practitioner?
No, you don't need
Sarah
to be
A.
Sorry?
That's from Sarah A.
Okay, so Sarah, no, you don't need to be a prescriber, and many of nurses who come on our course, they are not prescribers, so but then following their career, they do a prescribing course because it is beneficial to not rely on your prescriber all the time, especially if you have a busy practice. But to start with, no, you don't need to be a prescriber. Fillers are non-prescription, and to administer toxin, you would need to have a prescriber, and we can help you to get in contact with the prescribers and to put you into the right direction who can help you with that.
It's worth saying we do occasionally, we've helped delegates become prescribers by being their designated practitioner or offering hours within cosmetic courses.
And how long, guys, does it take? Can you explain how long it would take to become a prescriber?
Well, I think the courses that run for nurses, prescribing courses, are a minimum of usually at least 6 months, and they're attached to a university. I think it's about 90 practical hours they have to demonstrate. So often the nurses that I've helped mentor have done that through their NHS role, but already left the NHS. The route doing as an aesthetic nurse can be, that's where we've helped and been
so that's the V300, isn't it?
That's the V300.
So I think most so doctors and dentists are prescribers sort of anyway, and if you're nursing now, if you're a prescriber, Fiona, but in a different area,
it would be fine if you then have the training in aesthetics, you would be considered to be competent to prescribe.
So if you're a nurse prescriber in another speciality with the training,
you can then prescribe within aesthetics.
Okay, but if you're not a nurse prescriber, we can help you get there, or we can, there are solutions if you're not a nurse prescriber initially, which we'll talk to you in the foundation course. Here's a good question from an anonymous attendee. Can I just learn dermal fillers such as lip?
So the answer is our foundation day covers both, but we have had this question where particularly non-prescribers are interested in just doing filler. So it would be possible to put a bespoke day together where you just learn filler. We do consider lip to be more advanced, so it wouldn't be where we would start. We would consider other areas such as filler around the mouth, perhaps cheek, to be where you learnt your filler treatments, and then once competent in those, that you would go on to do perhaps a lip course. So the answer is yes, it's possible, but you would have to speak to one of our coordinators about how we would put that together for you.
Okay, well, questions are coming in fast and furious, so keep them coming, guys. This is another one. I've done the online foundation course and intermediate filler and Botox training day with your company. It was great. That's good, isn't it? Now I'm wondering how I can get started in my practice. Olya, do you want to take that one?
Sorry, is it just online course has been completed?
No,
or...
I've done the foundation, introduction and intermediate filler and Botox. It was great. I'm wondering how I can get started with my practice.
Well, it's all really depends if you, by the sounds of it, I think who put this question out feels quite happy and confident with the training that they receive. So the next step, I think in aesthetic, what you really need to do is start a little bit promote yourself, maybe have speak to the people that you know and see if they're interested in treatment that you do, offer to friends, family. And if you feel that you want a little bit extra practice before that, there is an option where you can come and run a clinic within a cosmetic courses setting. So this means that you can practice independently in the room for the procedures that you already train, gain your confidence, and there is always one of the trainer at the premises if you feel that you need any questions or just a second opinion. You can always come and call them for advice and second opinion. So that could be an option if you feel that you need this extra practice. And obviously there is still a long road for you that you can do more training, such as advanced Botox and derma fillers. So there is multiple options here, and have a look at the website Clinic People. Maybe you will find the right job advertisement there.
Brilliant. So we've got lots of questions and I think we've got 12 minutes. So this is a good one. Fiona, do you think the aesthetic market is becoming saturated?
I think there is increased presence on high streets and that people know about of people performing aesthetics, but I don't think a lot of people do it well. So I think there is still room for people who are medical, who are providing a quality service. So that aspect of it, no, I don't think there is. And I think there's still room for growth as the public are becoming more accepting of aesthetics, but also coming to expect better treatment.
Yes. Yeah. Another point is, guys, that, you know, only 5%, most practices are over 90% women, and of women in between sort of 30 and 55, you know, the main catchment, the main age, only 5 to 6% of people have regular treatments. So there's a big segment of the population there who don't have treatments, and you're right, they're becoming more normalised, aren't they? Yeah. And as again, the emphasis is to delay aging, slow the process, make someone look as good as they can for as long as they can. And also, there's a big thing that, Fiona, maybe you could talk about this. If you does it make people feel better?
Yeah, I think a big part of it is psychologically they've made a decision to do something about themselves and feel better about themselves, and how we look and present ourselves to the world makes us feel more confident, and that's a good thing. What we've got to be careful of is we don't treat people inappropriately who have, for instance, body dysmorphic disorder, and who are obsessing about something that others can't see and it's interfering with their social functioning. But most of our patients, by looking better, feel better, are more confident and happier, and that makes job satisfaction better as well. So.
And don't forget the medical uses. We can also train you in hyperhidrosis, which is a significant medical condition, very debilitating for people. So botulinum toxin could be used to turn off the excessive sweating, predominantly in the axilla. Lots of medical treatment, bruxism, over-clenching the teeth, lip lowering for gum show. There's lots of medical courses, and of course headaches. So the traditional 3-area Botox, particularly focusing on this area, Cabela, will resolve a lot of tension, headaches. So many of our patients, have the treatment for medical reasons such as headaches. Question for you, Olya. Is it best to have treatment on my own before applying for a job? I think this means
do treatments independently.
Yes.
So I would say, sorry, is it treatments on my...
Not on yourself, I don't.
Performing treatments yourself before approaching a clinic for a job.
I would say it's not always the case. What is important is that you just need to be open and honest with the clinic, and a lot of clinics who are recruiting practitioners, sometimes they would want to take a practitioner who's fresh from the training and also teach them their own way, their standards that they expect in the clinic. So being new to the industry, it's not always need to be seen as disadvantage. It's in many ways advantage as well. And I could confidently say this as a clinic owner, because some of the injectors that I have had in the clinic and having the clinic, they are delegates from our training courses, where you see that person has all the ability and you want to mold them and direct them in the way how you want your clinic to run. So on the other hand, I would say nothing stopping you from doing the practice and treat patients and people independently, even before you apply for jobs. And the more practice you do, the better you become. That is without a doubt. So if you feel confident, please start practice. Don't wait until you will get a job. This only will do good for your future career.
Okay, thank you, Olya. So just running through, so Sarah Lancy, hi, I don't have a medical background. Is the foundation course for me? Sorry, Sarah, it probably isn't. We only train medical professionals. Interestingly, these treatments are going to become more regulated. So at the moment, it's not illegal for anybody to prescribe, to treat a patient with dermal fillers. That's why we see so many lay people and beauty therapists doing these treatments. We sit on the JCC board. Regulation is coming in, and it is likely to be exclusively medical practitioners moving forward, but we'll keep you updated on that. Next one. What a great talk. I bottled paying for the level 7 this year. This is from Robert Miller. So Robert, please get in contact if you'd like to know more about the level 7. It is a commitment, but it does sort of future-proof you in a way, because it is likely that some sort of qualification will come in. It's looking like some of the existing practitioners may need to do a qualification, to get registered, and anyone coming into the industry will need to do a qualification. So it may do. So it's some people are opting to do the level 7.
And you get 20% off, which is a lot to save. So give Beth a ring. I mean, Beth's the coordinator to speak to, so she can answer any questions that you've got.
But importantly, if you are thinking a level 7, it's a good investment, but you don't have to do it.
No.
And any training that you do with us will count towards your level 7, should you decide to do it. This is a tricky one. How much can I expect to earn as a new practitioner? Well, it sort of depends what you do and how much work you want to do. So it's probably not, you're not going to start off earning a fortune initially. That's why lots of people have hybrid careers. You can augment your income by working in a clinic. A lot of people work in salons, which can work very well. They have an established clientele, but we'll give you advice on the pitfalls of that. There are pitfalls in everything, and we will give you advice on how to build your career. Okay, this is a good one. Lorna Evans, maybe only you might like this one. Do you train delegates how to correct errors, dissolve fillers?
We've answered that one.
Good. So we do. I mean, hopefully, if you're doing everything right, you shouldn't have to dissolve fillers, but we can do that. Do you have to complete the foundation course prior to any of the rejuvenation treatments, non-injectables? Fiona?
Generally, yes, we like people who've done the foundation course, but there are exceptions to that depending on what your other experience is and what you're used to doing. So if you're used to, in whatever career you've got, injecting faces, operating on faces, so that would be a situation where it's worth speaking to one of our coordinators rather than just booking online.
Okay, another one. How do you go about buying products for Botox fillers? Fiona, we'll try and run through these quickly before the end.
So generally people register with aesthetic pharmacies. So there's names such as Health Exchange, Churches, Wigmore Medical, where you register as a medical practitioner with them online and that can then purchase your products from them. For Botox, you have to provide the patient's prescription for them to send the toxin for that patient, unless you're a doctor or dentist where you can order stock. So fairly simple process. They deliver it to you quickly, but it's not from your usual high street pharmacy. It's not giving your patient a prescription.
So we'll talk you all through the procedure. Janice Grant, I live rurally and would love to begin my career, but I'm finding a prescriber locally is a major stumbling block. What would you suggest?
Well, normally we do have people to put in contact with you, such as aesthetic associates who are specifically designed, a bit like finding a nanny. They will put you together with a prescriber that they've got a list of prescribers in different areas of the country who would be interested in being your prescriber. But you do need someone who will see your patients face to face, and that's a legal requirement. They cannot do an online consultation for a prescription, and they also need to be available really for any complications you might have that you want a prescriber to see them if they need antibiotics. So it does have to be someone who will either travel to you or to where you are practicing, but that doesn't mean you won't find one. The BACN, for example, if you join the British Association of Cosmetic Nurses, can often put you in touch with local prescribers, as can aesthetic associates. So we can guide you with that.
Yeah. A couple of questions. George Bond, are medical treatments under the CQC registration? Ola?
So some treatments are. So for example, what you mentioned, Adrian, previously. So if we perform diagnosing and treatments such as hyperhidrosis, migraines, bruxism, gummy smile, then potentially, yes, you need to be CQC registered clinic. You can perform the same treatment, but not for medical, just cosmetic reasons, and then you don't need to meet CQC requirements. And certain procedures such as PDO thread lift, they classed as minor surgical procedure, so you must be CQC registered for that. And I think IVNT, intravenous nutritious therapy, it's become regulated as well, so you need to be CQC registered for that. Generally speaking, my personal view and opinion, if you want to do things right, get yourself CQC registration, but at the moment, if you just do Botox and fillers and it is cosmetic, no, you don't need to be CQC registered.
And we're CQ registered in all of our clinics. So
yes, we are.
Practitioners do come and use our facilities for their own patients. Right, just before we go, Hannah, I'm sure you will disclose the information on the courses. Do you advise practitioners they can purchase the equipment, for example, PIP machines? Yes, we do. So we have connections within the industry, and we can advise you on machines and the purchase of any capital equipment. We've got most of it, so we can show you, train you, but we can advise you on the best things.
In fact, the PRP centrifuge you can purchase as part of the course, so we can provide you with one.
And PIP is the, do you want to explain?
Platelet-rich plasma is the vampire facial. So it's taking blood from a patient, extracting platelets from that blood using a centrifuge, and then injecting the platelets to rejuvenate the skin.
Yeah. So George Bond, another one. If you've trained elsewhere, can you come for a more advanced course with us? The answer is yes. So we have lots of delegates who've moved from training providers to us. I think the main thing that we do slightly differently is that we actually have centres. So we have proper training centres with people like Fiona who work here and are here for support. And the other thing is we focus on treating real patients. So these treatments are on real people. So we really focus our training on real patients so that you get the best possible understanding how to talk to them, how to deal with them, how to choose the appropriate treatment. So I think other training providers tend to do mannequins and models, but it's really, really important to train on real people.
And sorry, Adrian, can I add here as well that we provide you with the models, which is a big advantage. So you don't need to worry about bringing over the model. And if you want to bring someone that you know and treat them as a model, you're more than welcome. But otherwise, you just need to worry about getting yourself ready for the course. Everything else is already organized for you.
Brilliant. We've got questions. I think this will be the final question. So it's from Janice Grant and Hannah Stacey, talking about salons and whether you can work from home. We will tell you more at the courses. There are pros and cons of all options. Some of our previous delegates have set up clinics at home. Many of them are set up. It's probably best to have a set clinic from your house. We'll talk you through the pitfalls of that. Some people work in salons or other establishments or with other providers, and clinic people can help you get a job. But come on the courses or contact us. I think we're running out of time now. But yes, we will advise you on the best way forward.
Has anyone won your prize?
No. Come on, you got 1 minute to tell me. No one's that confident. So yes, this will be available as recording. So the answer to the question, Fiona, is what?
Well, you would wash the eye out, but they
Yes.
certainly do not need to go to A&E or to...
Why not, Fiona?
Because Botox will only work where you've got the neuromuscular junction. It interferes with the chemical messenger between the nerve and the muscle. So dropping in the eye or on the skin, sadly, actually isn't going to do anything. No. It does have to be injected into the skin.
Yeah. That's why Botox, creams with botulinum toxin in don't work. It has to be injected or introduced under the skin, and the level of injections will teach you that as well. So for hyperhidrosis, for example, it's much more superficial injection with a very flat needle, and for muscles it's very different. So we'll teach you all the techniques in cosmetic courses. So we're going to go now, so I'd just like to say thank you very much for joining us on this Thursday night. Please, if you are interested in aesthetics, it's a brilliant career. And we love teaching it, and we're really passionate about it. So if you are thinking of a career in aesthetics, please contact us and chat to our team. And anything else, Fiona and Ola, before we leave?
No, I think we've covered quite a lot. So if you can just email one of our coordinators or phone to speak to us if you've got any other questions, or if there is something specific you want to speak to perhaps a clinician about. There's usually someone who can speak to you. So any questions you have a think about it, contact us, use the code if you're interested to get that discount.
Ola, anything to add?
Well, I think it has been very, very interesting and interactive hour with either our delegates or people who are potentially interested. And the one thing that I would just add, that I think with training, like with any like with patient in the clinic, all aspects is very important. And at Cosmetic Courses, we thought about this, like, you know, you're getting support not just from the trainers themselves, but from admin team. So we are always there for you. So if you have any questions, you can always come to us. We have sometimes situation when delegates even need something and they can just come to our training center and we can help them in any way we can. So I think it's very important to find your training provider who will guide you through your journey and you feel this support all the time. And I definitely felt this way as a delegate with Cosmetic Courses myself.
Brilliant. Thank you, Ola. I'd just like to say thank you to all of us. So I've got a few names: San Khan, Irina Dougherty, Hannah, Naomi, Amber, Robert, Hannah, Irene. Thank you very much for your kind comments. Have a lovely evening.
Oh, so Hannah did actually put wash out. So if Hannah could be the winner of our prize. So, yes. So how would we, or would she have to contact us, or we will contact you with what the exciting prize might be?
So Hannah Stacey is the proud winner of the Cosmetic Course prize for tonight. So well done, Hannah. In contact with the prize. Thank you very much, guys, for joining us, and we'll be going now. Thanks again, guys.
Thank you.